Welcome and thank you for joining us for today's webinar on Consumables and the MBS, Optimizing Patient Care. In the spirit of reconciliation, PracticeHub acknowledges the traditional custodians of country throughout Australia and the connections to land, sea and community. We pay our respects to the elders past and present and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Thank you for joining us for the latest PracticeHub webinar. We have had yet another overwhelming response to this webinar, so clearly it's a topic of much interest, and we have a great panel with us this afternoon who will be addressing some of the many questions which have come through during registration, which we thank you for. On our panel this afternoon, we have Amy Assigal, Director of Practice Partners and Innovate Health Group, with over 15 years experience in the medical industry. Amy has an MBA in finance and a diploma in practice management, and her expertise in healthcare projects provides an experienced perspective and knowledge around the efficient running and operations of medical centres. And Anna Maria Gibb, the co-creator of My Practice Manual, now PracticeHub. Anna Maria has a background in practice management and qualifications in business and adult education. I will now hand over to you, Anna Maria.
Fantastic. Thank you, Katrina, and welcome everybody. As Katrina mentioned, we've had an amazing response to this webinar today. So what are we going to be covering? We're going to talk about the MBS rules, billing and claiming consumables, how to access up-to-date correct information, how to ensure your practice team is aware of the rules around billing consumables, mention about the shared debt recovery scheme, the process to follow. And we'll also be hearing from Annalone Dalhoff from Team Medical, who's going to talk about maximising the benefit of the PracticeHub partnership with Team Medical. So Amy, let me hand over to you to get us going.
Hi everyone, I'm Amy, as you've just heard. Now this topic's a bit of an interesting one. It's one that we get asked often here at Practice Partners. You jump on any of the practice management forums, it's also something that gets thrown around quite a bit. So first of all, what I want to have a look at is exactly what are the rules. So what does Medicare place down as the rules and what are the explanatory notes that are online? So if anyone's had a look at GN 7.17, there is a billing procedure rule. And I just want to make note to the bottom section, which says it should be noted that where a service is not bulk billed, a practitioner may privately raise an additional charge against a patient such as a consumable. An additional charge can also be raised where a practitioner does not bulk bill a patient, but instead charges a fee that is equal to the rebate for the Medicare service. For example, where a general practitioner provides a professional service to which item 23 relates, the practitioner could, in place of bulk billing the patient, charge the rebate for the service and then also raise an additional charge, such as a consumable. So all of what we're going to be talking today is all around this particular rule. Now, there's a lot of confusion around this rule because we do have practices that are bulk billing, mixed billing, privately billing. But what we do need to remember is the billing style for what has happened on the day in the consult is up to that of the practitioner. So one of the most important things we'll be talking about is communication between practice and patient, GP and patient, nurse and admin and patient practice, so that we are all communicating exactly what the billing style for that particular consult will be, and also processing that through the PMS system in the correct way so that it reflects and adheres to the MBS rules. So first, I think we should note as well that the cost of a general practice is rising. So the cost of our consumables, everything that we purchase, from the mountains of gloves we're using these days to the mountains of masks that we're using, the costs are going up. Our staffing costs are also going up. So we need to remember that every time that we can be billing for anything that we use within a medical centre, we should be taking that up. We need to make sure that we're efficient with our staffing and we're training our staff and being as efficient as possible within the centre. But we also need to make sure that we're maximising the use of the MBS as much as possible as well. So how do we charge our patients? First of all, I want to have a look at the difference between a bulk billing practice and, say, a privately billing practice, and one that is mixed, so a little bit of both. You might bulk bill some items and privately bill others. So bulk billing is charging Medicare directly. So in doing that, you're accepting the Medicare benefit as the full payment. There's no out-of-pocket for the patient. So when you bulk bill, using the term bulk bill, it means that patient is not paying anything additional. So we just want you to remember that bulk billing word and how we're communicating that to our patients, because that's going to be really important in the upcoming slides. And then we've got privately billing. So patients pay for the consult upfront and claim their rebate from Medicare. Now, we can do that a couple of different ways within a system. So we can be doing that through online claiming. We could be doing that through our Tyro machine directly to the patient. There's a couple of different ways, or we can give them a receipt and they can go into Medicare or register online. So there's a couple of different ways we can do it. And also, privately billing is no restriction on what the practice can charge for their medical services. So you can be a bulk billing practice, but decide to privately bill some of your items or consults that you do within that practice. So ensuring, and that will make you a mixed billing practice. And that's predominantly what the practices are, mixed billing. So a lot of the practices that used to be privately billing, and now with the introduction of a lot of telehealth, there has been a lot of practices moved over to a mixed billing model. So now that we've got all of that out, I just want to talk about the communication on the billing styles that we're actually using. So this is really important. I'm trying to set the foundation before we start talking about how we might bring in a consumable charge into one of our consults. So we've got the doctors that communicate with the patients on what might be happening in that consult today. So it's really important to communicate with the patient on what's happening and what any additional charges might be for that particular consult. And also, it's really important for them to communicate what's happened in that consult to the administrative team out the front so that we can correctly bill for that particular consult. Billing through and finalising a visit is important, and also using admin notes are really important. The admin is really important because we're charging the out-of-pocket when checking out a patient. And the communication here is really important for a couple of reasons. The use of the word bulk billing is something that I've just spoken about. But when we say to a patient, there's going to be an out-of-pocket cost, whether we say there's a bulk billing charge, we're going to bulk bill that appointment today, and then we're going to charge an additional on top for a consumable, or whether we use the word or term out-of-pocket, that's something that we need to consider. Nurse, communication with the patient, so when they're actually doing the procedure. So it might be that we're doing a wound dressing or we're taking out stitches. There could be a mountain of things that we could be charging our consumables for. Now, when they're doing that, we need to express to the patient that there'll be an out-of-pocket cost for that particular consult on that day. And the use of a billing slip. So how do we communicate that particular out-of-pocket charge to the administrative team or to the doctor to what's actually happened in that treatment room at that particular time? Services, we want to make sure that we have a full list of services. What services may be bulk billed in a practice, what services may incur an out-of-pocket cost. We want to make sure that they're out, and they also can be displayed on our website and within our practice as well, so that everybody understands what an out-of-pocket cost might look like. And in terms of having communication with our surrounding members, like our PHN or MBS online or external consultants like practice partners, having a chat with them about what your fee structure might be and what costs that you're incurring within your practice, because we're all going through the same thing and no practice is the same. So we want to make sure that you're being able to maximise the cost or expenses that you're incurring in your practice, but also make sure that the correct communication and billing style so that we do comply to Medicare rules. How do we inform your team? Through signage. SOPs are really important. So when I'm about to dive into some examples, and it's really important to be able to have those out in policies and procedures so that each and every admin member can actually bill out that particular item number the same, and also that GPs know and understand how to communicate, but also how to process that through to the front desk as well. PracticeHub's a great way to store those policies and procedures, so ensuring that you have all of those into your PracticeHub so that can be signed off by each individual staff member and updated accordingly as and when the MBS rules change. Keeping up to date with PHN and any Medicare rules are important. Putting billing examples in, and I'm about to go through those in a second, but putting those into the different scenarios as well. So whether the difference between a flu vaccination and a wound dressing, the difference between someone coming in and getting sutures removed, or perhaps a facilities fee for an iron infusion, making sure that each of those scenarios are clearly put out in each and every policy and procedure. And then the use of internal messaging to ensure that what's happened on the day of the appointment is clearly conveyed through the front desk. So now that I've gone through all that, I'm going to go through the crux of how to actually abide by these Medicare rules, but also ensure that the practice is able to claim on their expenses, consumables, dressings as well. So in a bulk billing clinic, a practice performs, we could call it a wound dressing at this point in time. A GP consults with patient and the nurse does the dressing in the treatment room, which is generally what happens. So the GP wants to charge through an item 23, and in his eyes, he'd like to bulk bill that. So that's $39.10, which is the rebatable amount for Medicare. That's the Medicare fee that they state. The wound dressing, however, carries a $20 charge. Now, as we know by the rules, bulk billing a consult and then charging a consumable is not allowed to happen. However, what we can be doing is charging a $20 out of pocket to the patient for that item 23. That $20 out of pocket will cover the wound dressing charge. So again, we're not bulk billing the item 23 and charging a consumable. We're charging $20 out of pocket for the item 23. So the way in which we communicate what happened in that appointment. The total to the patient is $59.10 under the practitioner using online claiming. The patient is out of pocket $20, which is the wound dressing charge. Now, we've got to remember that the concessional loading is not applied if we're not going through a bulk billing model. So that means that the 10997s is not able to be charged through on this because we're not bulk billing the $39.10, we're charging it out of pocket for the wound dressing. So some practices like to take that into consideration and increase the wound dressing. But that's for you to assess all your fees coming into your practice and your consumables and expenses, and you want to make sure that we're actually able to cover those charges. How do we split the consumables to ensure the practice gets 100% of the fee when it comes to doctor disbursement is a common question that I get asked. And there's a couple of ways that we can be doing that. So in this case, because we're essentially charging an item 23 with an out-of-pocket cost of $20, it will go under the doctor's billing as $59.10. I like to put in a wound dressing at a cost amount of $0 into the billing process. So that shows when we're doing our doctor's disbursements and reports that come out, you can see how many wound dressings are there. We know that there's $20 out-of-pocket charge for those, and we proceed to take that off the doctor disbursement and bill that to the practice when it comes to the doctor disbursement time. So it's for us to allocate that after the fact. This allows us to be able to claim our consumables because we're not doing a bulk billing charge, we're doing an out-of-pocket cost to the patient. When it comes to privately billing, it's a little bit different because privately billing, we're able to charge an additional fee for consumables, facilities fees, because we've chosen the fee for out-of-pocket for the patient. However, what we're unable to do is privately bill some things and bulk bill other things unless it comes under the clause of an operation, okay, or a procedure. So in this case here, and we've had this example come through, so I'm going to use it as a live example, where we're charging through three different types, I guess, of different charges. So we've got a private consumables charge, we're going to call it $20. We've got a private item number 3, that's $17.90 from Medicare. Well, we've got an out-of-pocket cost at the practice of $40, so that's a total of $57.90. And we've got a bulk billing. The doctor wants to bulk bill for the removal of a foreign body. So the 303,061 is $24.45. So when we have a look at that, we've got a bulk billing, we've got a consumables charge, and we've got a private fee all in the one billing set. So a lot of people take a step back and think, oh gosh, that's so confusing. We can't bulk bill at the same time. We can't do that. Well, the answer is it's the way in which we're going to be putting that through and communicating that through to the PMS system. So by using the term bulk billing, it's the rebate only amount. Okay, so as the rule states, if you're bulk billing a charge, you're accepting the Medicare benefit only. But our system allows us to bring the item 30061 back down to the rebate only. So you can see what the rebate amount is. So what you can do, there's a total charge of $102.35. You have a total out-of-pocket costs of $40 plus the $20 consumable charge. So what we're going to do within our practice management software system is we're going to split the out-of-pocket cost, which is the private out-of-pocket cost of $40 across item 3 and item 30061, making them both $20 out of pocket. So essentially, we're still rebating the amount of bulk billing down to the $24.45, and we're charging privately for the item 3, but we're splitting up the out-of-pocket cost of $40 across those 2 items. The reason we're doing it that way is because they go against the doctor's provider number, and that can be sent to Medicare, and the rebate can come back through Tyro or online claiming. And then what we're going to do is charge the consumable separately to the practice in a separate account for $20. So as you would do in a private practice, we bill the item numbers for Medicare to the doctor, who will attract a Medicare rebate, and then the consumables charged to the practice. When we get to the scenario here where we've got a consumables charge and 2 items that we're claiming through Medicare, those 2 items can still go under the GP's provider number. We split the out-of-pocket cost of $40 across the 2 item numbers, meaning that they're both the same out-of-pocket cost, however, privately charged across the 2 items, and you can process that through Medicare. So I hope that makes a little bit more sense for everybody, but that's how to get around it in terms of a private practice. So what we need to remember is the communication style of bulk billing. So when a doctor has asked to bulk bill a particular item, bulk billing refers to accepting the benefit for the Medicare rebate. So that's $24.45. So we're not charging anything above that. We're just splitting the out-of-pocket cost in our system to process to Medicare, to abide by the Medicare rule of being where you're either privately billed or bulk billing. Okay. So when we have a look at how we might do that, so again, impact on billing disbursements. In my scenario of the bulk billing, the impact is that we no longer have the charge for consumables. So when we are billing our disbursements to our doctors, we don't have the consumables charge going to the practice. So when we're doing our reports at the end of the month or end of the fortnight, you will see generally the practice fees, which are our consumables to the practice, and you'll have the doctors, what they've billed to their patients, what they've receipted to their patients, depending on how you disperse. So with this particular scenario, you'll need to ensure that when you're putting the item code, or which is one that you'll create, wound dressing or facilities fee, making it as a $0 amount so that you're able to track that at the end of the month and take that facilities fee or wound dressing charge off the doctor disbursement prior to doing the split, whatever that may be. So the out-of-pocket cost associated to an item number equal the value of the desired consumables charge. So if you're bulk billing, you want to make sure that the out-of-pocket is associated with the item number equal to the value that you want to charge for your consumable, whether that's a wound dressing or a facilities fee of some sort. Charging consumables at a zero balance to capture the amount of services associated with that provider at the end of the disbursement period is also really important in a bulk billing scenario. Provide out-of-pocket costs across multiple items. So in a privately billed scenario where you've got some items bulk billed, other items privately billed, and you may have a consumable in there also, you want to divide those out-of-pocket costs across multiple items within your practice management software system. So I've got a scenario there, and I do have different policies and procedures and standard operating that we want you to have as well if you're with best practice. Rather than recreate them, we're happy to share them with everybody, and you can tailor them to your own practice. I do have some screenshots on how to change an out-of-pocket or gap amount. So having an item number associated, double clicking on that item number and being able to bring it back to rebate, adding the out-of-pocket cost, and you would see the gap amount change to in the scenario we just looked at, $40 if you're dividing 20 into the 2, 20 and 20, making 40. So communication and correct billing allocation is the key here. So when we're talking to patients, and we may be a bulk billing clinic, which is a lot of where this scenario comes from, is, we fall into the trap of, well, we can't charge any additional. In the Medicare rules, it is up to the doctor's discretion in regards to charging a patient their own fee above the bulk billing or the benefit, or charging on the benefit. So whether we charge that at a bulk billing or whether we charge an out-of-pocket cost. And that's why the communication to the patient is really important. If they're coming in for an iron infusion, for instance, or they're coming in for a procedure that attracts a Medicare rebate, but we're charging a out-of-pocket cost for a facility fees or a wound dressing, it's really important to be able to communicate to the patient the out-of-pocket cost that's associated with that appointment, rather than raising a fee, a facilities fee on top of a bulk billing that you claim directly through Medicare. Again, I want to stress to you that the 10997s don't apply here. So we need to make sure that you will miss out on that 10997s. I have a lot of questions in regards to goods and services tax, or GST, on consumables. So I've pulled up, and just down the bottom here, from the ATO. So goods supplied as part of a GST-free health service. A supply to goods in GST-free, it is both a necessary part of providing a GST-free health service. So supplied at the same time and place as the service. The goods must be either specific to treating the illness or disability of a particular patient and essential for treating the patient during this particular consultation. So therefore, consumable charges are GST free. Okay. Now, the reason I'm bringing up and making sure that we are on top of claiming our consumables correctly, it's important not just for the GP, but also for us as the practice. So a few years ago, we were introduced to a shared debt recovery. So some of the key points to a shared debt recovery, and I urge you all to do your own research in regards to shared debt recovery. It's important for us as the practice to ensure that we've trained our staff and we have the correct policies and procedures in place, but we're also exercising the correct way of finalising that billing process and sending that to Medicare. And the doctors have the same responsibility to ensure that they're billing correctly for what has happened in that consult. We're not going to intervene every single consult. They'll bill through and finalise a visit without us knowing what's happened. So it's up to them to choose what happens in that visit and to bill appropriate, and for us to finalise a visit appropriately also. So a couple of key points here to the shared debt recovery is that GP and practice are working together. So this is the words of the shared debt recovery. The GP and the practice to work together to minimise incorrect billings. So exactly what we've spoken about today in terms of processing it through to Medicare correctly, dispersing any out-of-pocket cost appropriately, and ensuring that we're not bulk billing one item and privately billing a consumable at the same time. Admin team to review and ensure correct billing rules are applied. It's very important. Practice supports the practitioner. So to ensure all elements of an MBS item for which benefits have been paid have been met. So it's important for us as the admin team at the front desk to ensure that everything is correct going through our PMS system. Practitioner, the only person to determine the service. So determine that a Medicare service has been delivered in accordance with the requirements of the MBS, and it also states that there's no influence from the practice on what they charge. Any changes must be authorised by the practitioner. So preferably in the patient health record. And that's why in a previous slide here, I've highlighted this section, notes from the provider. It's really important for the GP who's providing this service and popping in a consumables or a facilities charge to indicate down the bottom what the out-of-pocket cost would be for the overall appointment, to ensure that when it's processed at the front desk correctly, that it's allocated in the right way. Those particular notes from the provider remain with that appointment in our practice management software system. So it's important that we note that. And shared repayment of debt. So it states the practitioner and practice, who's the secondary debtor, a shared debt is determined by the arrangement between the practice and practitioner and level of influence and control secondary debtors have over billing services. That's the importance of us not changing or diverting from what's actually happened in that appointment. So, for instance, if something was to happen throughout in a treatment room, for us to then add a facilities charge without the knowledge of the doctor would not be the right thing to do. So it's important for us all to communicate and have the right policies and procedures and fee schedules set to ensure that everybody in the practice is aware of how we claim on consumables throughout the appointments. I just want to go through some practice fees and tips, and I know there's going to be some questions, and I'm happy to run through some scenarios with you all. And again, it's really in regards to the communication and how we build that through our practice management system to ensure we adhere to these rules. So the use of the Repatriation Pharmaceuticals Benefits Scheme, the RPBS, is really important. So some questions I get is, how do we claim a wound dressing through a DVA patient, for instance? So there is, under a RPBS, there is scripts that you can run up for wound dressings. So when you do have a DVA patient that comes in for a wound dressing, you are able to run a script. They take it to the pharmacy. They will actually collect their wound dressing materials and come back to you. And that is fully covered for them. So they'll bring their wound dressings back. So you won't need to use the practice's private wound dressings. That won't be able to happen all the time. Of course, when you first get a DVA patient in the door and they need a wound dressing on that day, sometimes it's not feasible to send them out with a script to go get a wound dressing. However, please try and use those scripts because they are available and they will be able to collect all their wound dressings and come back to you. Number two, introduce 2 billing schedules. If we can put as many billing schedules as we like in our systems, making sure that we have the terms direct to Medicare rather than our bulk billing and out of pocket. So when we want to go back and divert and charge through the rebate amount. So for an IM23, $39.10. If there's a consumables charge on top of that or a wound dressing charge, I'm using that as an example today, making sure we're using the term out of pocket cost, not bulk billing this and charging this. Patient consent forms, using consent forms to inform patients of any out-of-pocket cost or charge associated with a particular appointment. If there's an out-of-pocket cost for an iron infusion or a wound dressing or any procedure that's happening within the practice, when you've got your consent forms filled in, have the out-of-pocket charge there for the patient to see. Yes, I think we run into trouble when we are a bulk billing practice or people associate us as a bulk billing practice and there's all of a sudden a charge to a particular appointment. It's important to communicate and inform the patients of those out-of-pocket costs that will be associated with that appointment. Private flu vaccinations. So we use the same method of an out-of-pocket, billing to the practice and billing to the patient. So it does state on the initial MBS rules there in regards to vaccines as well. So making sure you have a look at that, but you are able to charge a fee for a private flu vaccination, ensuring that the patient is not eligible for the National Immunisation Program. And if they are not, then they're able to be charged a flu vaccination at the same time as a consultation. Services, clear services listed in each GP room to guide on billing notes. So it's important to be able to have the same billing schedule and services charges that may apply to particular procedures within the practice stated so each practitioner knows exactly what to charge through and what notes to put on. And of course, they choose what has happened in that appointment to associated to what the billing schedules are. So it's really important to communicate that through the team. And then team meetings are really important to run through common scenarios within the practice. So ensure that everybody's aware on what the correct communication and the correct way to build that through. Because as we just had a look at the shared debt recovery, we both ourselves and the practitioners hold a responsibility to abide by the MBS rules. So it's important that both of us abide by the same rules.
Cool. Thanks, Amy. Look, I think what we might do is, why don't I run through some of the questions that have come up? Can you bulk bill with private flu vax?
So on the initial, under the GN 7.17, it does have a section in there in regards to vaccine. So it does say that whenever a patient is bulk billed, an additional charge can only be raised against the patient by the practitioner where the patient is provided with a vaccine or vaccines from the practitioner's own supply held on the practitioner's premises. So that is anyone outside of the National Immunisation Schedule. So if they're not, asthma or on a care plan or over the age of 65, yes, they can be charged with a bulk billing charge at the same time.
Fantastic. All right. Good question here. Is team communication considered influence? So I guess, it depends on the type of communication?
Absolutely. We're not influencing, we're not changing anything or telling them what they should or shouldn't bill. What we are is communicating the way in which we're charging through consumables that are bought by the practice. Whether the doctor chooses or not to actually bill them through that way, that is up to the GP themselves. We can't influence them to actually use the rules that we put in place. But what we can do is talk to them about ways in which we're able to, cope with the fees to run the practice.
All right. And we're looking for clarification. Are you saying that any consumables have to be on the same invoice? Could you not do one invoice under the doctor, e.g. the 23 at the rebate amount, and then the second invoice under the practice for the consumable?
Yeah, so look, when we're doing something like that, a rebate amount means the patient gets $0 back. It does state that there needs to be something over and above the rebate amount of $39.10 as an example. So by following the rule of putting it through as a charge over and above that means that it's not essentially accepting the Medicare benefit. What you're doing is actually charging an out-of-pocket cost for that particular appointment as a whole. So in terms of a fail-safe method, I always use it being on the same invoice.
Can you charge gap payment for surgical procedures in the case of DVA patients?
The answer I would say is no for DVA. I'd have to have a look in DVA more. I'm looking at specifically the MBS at this point in time, but I will have a look at the DVA for you. There are some specific rules around DVAs that do vary from the MBS.
Yep. Okay, that's good.
So the 10990, yes, that's the concessional payment. 10997s can be charged, but will need to be split with an out-of-pocket charge.
Excellent, because I think there's a couple of people who have made comments around both those item numbers.
Yeah, sorry, that was my typo.
There's a question around, can practice charge patient treatment room fee? So I know when you were talking, you talked about the facility fee. So would you mind expanding on that a little bit, please?
Yeah, so whether you call it facilities fee, consumable fee, wound dressing charge, whatever you like to charge, to call that, yes, you can. It's an out-of-pocket charge for that particular appointment. And it does state in the Medicare rules that a private facility can choose what they charge in an out-of-pocket cost. So we have the ability to be able to choose what we charge a patient above and beyond the Medicare benefit. So whether you choose to call it an out-of-pocket cost or you call it a facilities charge or a treatment room cost, yes, they're all the same. They're treated the same way.
One of the things I heard recently, and I don't know if you think this is a good idea, and it feels old school but effective, is somebody mentioned that the patients get like a coloured slip of paper with what they need to be billed, and the practice staff, that kind of seeing that coloured paper in the patient's hand actually kind of triggers that, okay, we need to go, that patient needs to come, we need to see what they need to be billed. What are your thoughts on that? I just thought it's kind of old school but very effective.
Absolutely. So we've one of the communication screens I had there is called billing slips. That's exactly what that is. Whether you decide to colour them or a lot of people just write down what it is and they use a whiteboard marker, they laminate them, use a whiteboard marker, wipe them off and clean them and use them again. We do have some troubles with patients putting them in their handbags and forget to present them out. So it is important that the practitioner does put those item numbers in, or the nurse communicates with the practitioner. Again, it does go through with that influence. So we want to make sure that the doctor is well aware of what's going through on those bills through to Medicare.
Cool. I'm going to hand over to Annalone Dalhoff from Team Medical. Annalone is the marketing director at Team Medical, and she's going to talk about the benefits of the partnership for PracticeHub customers that we have with Team Medical. So over to you.
Thank you, and thanks everyone, and thanks Amy for all the information. I know as a lot of people commented, there's lots to digest and listen again. So great. We're really excited that we are partnering with PracticeHub because we believe both of us are very experienced in this industry, but have a lot of extra value to add for all the practices with efficiencies and how you run your businesses. So if you haven't heard about it, we are excited of this new journey. And when it comes to what we're talking about today, it's one of the examples where this is a very good time to focus on revenue generating activities if you haven't already. Yes, we're hearing costs are going up. This is a very good time. So listen to this, but as well reach out to us. We're happy. Our reps out on the road, our customer service people are there. So happy to help making this more of a focus for your business going forward. And the relationship with partner, PracticeHub and Team Medical, there's so many advantages, whether it's the system you're already using, PracticeHub, then definitely go on there. You might not have seen it yet. On the dashboard, you can actually link to Team Medical. So please do go and link your accounts, which means that you'll get extra value and opportunities from the medical supply side from that. And some of you are Team Medical customers. If you haven't already, go and have a look or find out more about PracticeHub, because it's a great combination of having all your compliance and policies and knowing what to do with MBS and a lot of other things in running a practice. And on the other hand, having the medical supplies and the knowledge we help bring, because things are changing very fast. So that's all we just wanted to say here. We're excited to collaborate, and whether you're customers of either of us or, definitely get in touch, because the more you know, the more you can help the rest of the practice and the more you can help patient outcomes, which is what we're really passionate about, all of us. So thanks.
Fantastic. All right, lovely. Thanks, Annalone. What I'm quickly going to do is give you a bit of a demonstration of PracticeHub so that you can see, particularly in reference to what Amy has been speaking about today. So for those of you who are PracticeHub customers, some of the policies and procedures that I'll be showing you will look very familiar. And some, for those of you who are not PracticeHub customers, this is one of the benefits. It's not just a technology platform, but it is also the content that we provide as well that is really valuable for your practice and for your team. So when I thought about what we were going to be talking about today, I thought about it from the perspective of where does PracticeHub come into this? And what I've done is really just kind of thought about areas where it's important to document, and Amy certainly mentioned about standard operating procedures and communication and the importance of that and that consistency and ever awareness as well. So having documented policies and procedures around this is really important. So one of the areas I thought about is your appointment management. So including in your appointment management, you know, the appointment type, if it includes things like that there are dressings required and things like that, making sure your appointment management system caters for that as well. And so having that information in there is really important, you know, from your booking an appointment, noting those sorts of things, asking those questions as part of the process. The other area that I thought was really useful, again, was around consultation fees. And so I guess this comes to things like informed financial consent. And again, awareness, not just for the team, but for the patients. So once again, Amy's mentioned a lot around making sure that your patients are aware of these additional costs or out-of-pocket costs as well. So having a consultation fees policy that talks about that so that you have that information easily available for your patients. And you might also, if it were me and in my practice, I would probably have the signage that we have up in the practice. I would probably have that linked to this page so that anytime it needed to be updated or a new, you know, another copy printed and put somewhere, that would easily be accessible. So the beauty of PracticeHub is connecting up all that information in one place as well. Then, because as I've been listening and realizing, this is quite a significant area. So whilst you could have the fees for the consumables in your consultation fees policy, I'd probably even consider creating a second page. And so it would be a policy around, you know, we're committed to evidence-based care, compliance with the MBS rules. And our procedures would include things like notifying patients of the cost, who determines which items are billed. And then, as Amy had that example from best practice about doing that, so insert examples of what the document, the billing invoice should look like. Maybe have a list of the most commonly billed items. Again, of course, being aware that you need to make sure that you have current information, not out of date information. And then step-by-step guides, or even with PracticeHub, you could insert a little video, take a video of how you do this in your patient management system, for example, Best Practice or Genie. Take a video of the steps to do the billing and put the link to that in your PracticeHub site. And this makes it a really fantastic training tool too for new staff as well. So they're not guessing, they're not kind of looking for the information. If they're on their own at the desk, they can simply go and find this information, or it acts as a reminder, but at least it's there. Other things I would be including is a link to the MBS online page. And again, because you've got a hyperlink in there, it's always taking you to the most current version of that information as opposed to out-of-date versions. And I know they do change fairly frequently. The other nice thing to have in here is this reference to other related policies. So I tend to think policies and procedures don't live in a bubble. They don't just kind of sit on their own. There's sort of this connection between policies. So I would be linking this to the other policies that I've shown you already. So appointment management and consultation fees, and I'll show you the shared debt recovery one in a moment. Now, those of you who have got eagle eyes will notice the red banner at the top and bottom of the screen. And the purpose of this is to allow you to have your team electronically sign off that they've read and understood a policy. So it's all well and good to have this information, you make it accessible, but the last step in this is actually having evidence that people say they've read, understood, and will comply with this information. So in PracticeHub, you can assign that according to people's roles. And so when the user goes in, this is what they'll see. You're required to read this as part of your induction and compliance. And then their name, Karen have read and understood and agree to comply with its provisions. And they click on confirm. And now you have an audit trail of the date, time, the person who has signed off that they've read that policy. If in the future you update the policy, the same process starts all over again. They're alerted that you've updated it. They go back in, they have the banner, and they go back through and confirm that they've read and understood the new version of that policy. So that's a really useful time-saving risk mitigation process as well that's in the system. Once again, Amy mentioned the shared debt recovery scheme. Now, we do have a policy and procedure around that. Again, I think the benefit of this is that it's been produced by people with expertise in this area. And again, you can kind of see what we've done here is add additional resources, which I think is really valuable as well. So even the FAQs around the scheme is really useful for your team to have that information. Now, what else did I put in this list? So something we probably haven't touched on, but I also think is when, thinking about consumables, I think we often think about medication, but I believe a lot of consumables also have use-by dates. So again, considering that those should be considered as part of this process of managing, storing and disposing of those items as well. So just a kind of a thought around another aspect of managing your consumables. Amy also mentioned staff meetings. So when you're having staff meetings, so really important that you document, that you minute your staff meetings, and PracticeHub allows you to do that. So I would have a standard agenda, and what you can do is after the meeting, you can upload the meeting minutes and notify your team that they're available. And I guess at this time where you have a lot of part-time casual staff, maybe people don't get to every meeting, the fact they can easily access the meeting minutes and see what was discussed and decided is also really useful for sort of openness and transparency and consistency as well. Again, I had a page of staff meetings and also clinical meetings because it's important that you also document clinical meetings as well. Now, of course, we are excited about our partnership with Team Medical Supplies, and Annalone mentioned how easy it is to access the Team Medical Supplies page from your PracticeHub site. It's down here in our integrations section, and if I click on here, as Annalone mentioned, it's really simple to link up your existing account. So if you have your Team Medical Supplies account, you can link the account. If you don't have an account as yet and you are using PracticeHub, you can create a new account. And once you've signed off on the T's and C's, it's literally as simple as just linking. Every time you go to order your consumables or whatever products you're ordering from Team Medical, you would simply come to PracticeHub, go to the integrations, click on the link to your Team Medical account, and it will take you directly there along with any of the additional information and benefits that are there for PracticeHub customers. So a very simple, streamlined process. If you're already ordering through Team Medical, this is just a slight change in how you get to that site. And if you don't use Team Medical or you don't have PracticeHub, I think this is a great benefit for both our users as well. We've got just a couple of minutes. Is there anything, Amy, you wanted to speak to that you've seen come through?
Yeah, quite a bit coming through as can a practice charge the consumables straight to the practice company as a separate provider and not under the GP. So it still falls under the Medicare because that patient consultation is under the practitioner. So when the consultation is the consult item 23 and then you as the practice are charging an additional, it shows under, and we've got to remember the shared debt recovery scheme is that we're taking, I guess, joint responsibility of this particular account. You can be seen in an audit situation where you're charging then a private charge on top of a consultation at the same appointment. The same consultation, if you think of it as a consultation and you're doing a bulk billing charge, but you're also charging them a private fee under that same consultation banner. I know a lot of people split them up in terms of a doctor disbursement front as well, but to ensure we comply with the GN 7.17, we want to make sure that we are not seen to be charging a bulk billing charge and then also a private fee. So I think under a bulk billing, if you have a look at the definition of bulk billing is when a practitioner accepts the Medicare benefit as full payment for that particular consult. So we need to make sure that we're not accepting the bulk billing or the Medicare rebate as the full fee, but then on charging another fee to the patient. So that's what they don't want to be seeing under that rule. So I hope that clears it up a little bit, but there's a few questions around that question, or there's a few worded all different ways, but I hope that clears that up a little bit. What if 2 consultations happen? I just think if there's 2 consultations happen, then it's 2 consultations. We just need to make sure that 1 consultation isn't just with, if it's 2 consultations on the same day, then yes, they're 2 consultations. But if it's 1 consultation, then it's one, the billing is together under that consultation.
Very good. Okay. I might just answer the question about the PracticeHub policy and procedures. Do the policies on PracticeHub, can they be downloaded and personalised? The policies are part of the PracticeHub platform. So if you purchase PracticeHub, you get the full suite of policies. And we have policies for different types of practices, general practice, various specialist types as well. And you can customise them in the platform, but they're not really designed to be downloaded. But if you are interested in any of those policies, perhaps send us an email.
In terms of the 10997s, there's a couple on that as well. 10997s is the nurse charge. Yes, again, it's like another item. So like the scenario I had a look at with the item 3 and then the item 30061, same scenario, splitting the out-of-pocket cost up against those 2 items.
Mm-hmm. Okay. And just confirming, the RPBS only applies to DVA. That's correct, isn't it?
Yes.
Fantastic. All right. Thank you. I might move on to next steps. Keeping track of all these slides at the moment. Okay, so things I wanted to highlight for you. If you're already a PracticeHub client and this has sort of raised some questions of how can we help you use your system better, please give us a call, reach out to our lovely support team. If you're not a PracticeHub client, I highly recommend you visit our website to find out more about the features and benefits. If you do need more resources, please go to our website. There's some terrific articles there, and also all our webinar recordings are on there as well from previous webinars. All right, we've a couple of minutes left. Is there, Annalone and Amy, any last thoughts and comments from today? So maybe Amy, to you first.
I think just based on all the questions that we've had, I think they're all really good questions. I think we just, in each scenario, try and take a step back and have a look at, first of all, the rule that applies, but also how you might represent that rule in your system. I think a lot of people hesitate when it comes to the principle of it all. Whereas if I'm bulk billing a patient, but then I'm having to have an out-of-pocket, does that make it a private charge? Yeah, it does. Not using the term bulk billing and using a term out-of-pocket. As long as that's clearly communicated, you're in all rights to do so. So I think we just need to take a step back from it a little bit, have a look at how we're going to present it in the system, how we're going to communicate to our patient. They're the key points that we want to take away from today, and ensuring that everybody's on the same page.
Very good. Thank you. And Annalone?
Yeah, I just wanted to thank everybody for being on here and the passion. And I can feel, everybody wants to understand and know. And I really appreciate you're all doing such a great job every day in your work. And there's so much information to stay on top of. So, let us help you wherever we can. But I love the passion and the questions. I think that, well done, everyone.
Fantastic. All right. Thank you. Thank you to all of you who attended today. We've had fantastic numbers. So obviously a topic of great interest. So thank you very much. And thank you especially for your engagement. As Annalone said, there's a lot of passion, a lot of questions, a lot of information that people are really seeking, and hopefully we've been able to provide. So thank you, and we look forward to seeing you at our next webinar.